Or maybe Andy Burnham will succeed where past PMs and governments have failed and fix our system of social care. 23rd time lucky. It could happen. Burnham sounded as if he meant it when he said he'd never forgive himself if he didn't try, didn't give it everything, and he'll need to. The truth is, he won't just need to stop this latest attempt sinking in a mire of political point scoring. He'll have to wake us up, millions of us, most of us, to the frightening truth of the state of our care system. Because, and this is maybe the really shocking thing, most of us haven't got a clue.
I haven't really thought about that too much.
If anything goes wrong, I really don't know what's going to happen there.
So yeah, I haven't really planned for the future healthcare-wise.
Well, we're going to be hearing more from members of the public in just a moment. 1 in 3 of us, according to research, 1 in 3 believe that social care comes free and is funded by general taxation, like the NHS. That is a lot of our heads buried in very deep sand. The average bill for residential care is actually about £5,500 a month, more in London and the South East. Sometimes the care's excellent. Too often it's appalling. And is the PM right to challenge this and to call the challenge we're facing urgent? Well, 12 million of us and rising are aged over 67 now, 14 million over 65. So what do you think? How much of that ends up as a profit, these funds into social care in the bank accounts of big corporate investors? Well, too much, says Burnham. But what do you think? And if it is the state that has to do it, how is it to be paid for? Send me a text, 87222. Start with the word Times, or a tweet to @TimesRadio. Now, Andy Burnham, then, he gave that speech earlier on adult social care, pledging to lift up workers through pay and training. The new PM outlined the need to reform the sector.
It's a major dereliction of public duty that Parliament has not faced up to this, of all challenges, something so fundamental to life as this. It's shameful, to be honest, that politicians have put point scoring before fixing this issue. But that's what's happened. It's created a feeling in Westminster that this is too difficult, and if you take it on, you're taking on too big a political risk. Or how come we've got to a position where it's too difficult to fix the basic care that we give to each other?
Andy Burnham earlier. So Anna Mikhailova is our political editor at Times Radio. Hello to you, Anna.
Hi, John.
Hi, tell me, what are your takeaways from Burnham's curtain raiser to this latest attempt to reform social care?
Well, I mean, the reactions so far have been people are pretty pleased to see him sending quite a clear signal that this is a personal priority for him as Prime Minister. It's hard to find anyone who has looked at this issue who doesn't think there needs to be a solution. It's just obviously the difficult bit is how it's done. But, you know, for example, I spoke to a Treasury Minister this morning about it, and they seem to think that having Burnham at the top has changed the approach already, even within just over a week of the way the government is functioning, and that when they are getting much clearer signals from the top of what he is interested in, that is making the machine run differently. And the big question is, will that therefore filter down into actually finding a solution for social care? I think having Louise Casey there this morning lent it a lot of heft. She is doing the independent review into social care. As it was announced today, that will be brought forward by a year. But the fact that Burnham is saying he will back whatever she proposes 100%, as he said, that is interesting in itself. It could potentially tie him up with quite serious spending commitments, though. That's the bear trap he could end up walking into.
Yeah, well, in the end, it does have to come down to funding, and that's going to be the really pointed end of all of this. In the meantime, the business of reforming social care, Anna, it has the record of so many past failed attempts hanging round its neck. So it needs a sense of mission and urgency, doesn't it? And you can say that the Burnham's own father's dementia provided some context to his approach.
Well, he spoke at length about his father. He also, of course, spoke about his attempts to do something about social care when he was health secretary back in 2009. This is clearly very personal for him, both in terms of what he felt was the Westminster machine and the establishment hampering him the first time round, And he alluded to, for example, lessons he's learned from that experience, and the fact that it was scheduled too long, too late into the parliamentary session then, which didn't give it enough time. Therefore, he wants to avoid that as much as possible this time round. So you could really sense that, and of course the message about his father. He said at the end, as clearly as you possibly could, he says he is doing it for his dad. Being there today, John, he is talking about a very, very important, very, very difficult issue that the government, endless governments, as we've heard, 22 attempts to address it over the last couple of decades, and a failure to do so. So he is saying that he's willing to spend political capital on that. But I think, again, the big question is, what is the detail? When are we going to see it? So far, before Louise Casey concludes and presents her findings, it doesn't look like we will see any specific detail. So we are left waiting. But I think him just having that as his first press conference this morning, it does send a signal to the machinery of government that this isn't just a throwaway line within the manifesto anymore. This is actually something that is a personal commitment to the Prime Minister.
But Burnham's being accused of posturing by his opponents. Maybe no surprise to that. Point scoring is absolutely inevitable. And there are genuine difference of thinking when it comes to taxation and public borrowing. How to get some progress achieved with any degree of cross-party consensus there. The issue there, among other things, is going to be how far does it get enmeshed in the electoral cycle?
Well, and also we have had Louise Casey allude to the cost that fixing it would take. We have had absolutely no numbers or detail, but I think everybody knows that there will be a significant price tag attached, especially if we are to head down the National Care Service free at the point of use route. We've had the Conservatives already say that they would only agree to work together and back a solution if it meant no new taxes and no extra borrowing. Andy Burnham hasn't and isn't likely to make that sort of commitment at this stage at all. The only thing he did say today, which was significant, is that he repeated his pledge to stick to the manifesto commitments on tax. So that is a pledge to not raise the three big taxes: income tax, VAT, and national insurance for employees. But there are lots of other taxes that are on the table, as he said already. There are other options of fundraising, and there is borrowing. So there's all these questions presumably will be answered a little bit in the budget. Perhaps there'll be a statement of direction of travel then. But broadly, we might also be left waiting, as I say, until Louise Casey comes back with her findings.
Yeah, I presume there won't be anything very substantial until Louise Casey has her say. Anna Mikhailova, thank you so much. Let's welcome to the programme now Luke Tryl, the director of the Polster Mooring Common. Hi to you, Luke.
Great to be with you.
Good to have you, as always, Luke. I mentioned earlier on a survey which showed that 2/3 of people actually believe that social care, residential social care, is paid for through general taxation, that it's free in the same way that the NHS is free. So this national conversation we're talking about starting now, the level of understanding is a pretty low base.
It is pretty low, and of course, and you sort of heard it in those clips. It's the sort of thing that lots of people actually are secretly hoping that they won't have to rely on too soon. It's the sort of thing which people want to avoid. And I should say, when we have conversations in focus groups, it's rare actually for social care to emerge on its own as an issue that people are thinking lots about. Now, those who have experience with it, particularly those who have had struggles with elderly relatives, are very animated by it. But I think a lot of the public put it in that it's a bit too difficult, it's a bit scary, I don't want to think about it box. And as you say, knowledge even of the basics of how it works, who pays for it, what the thresholds are, and indeed, even how much of local authority funding goes onto it. We know it's a significant chunk of what local councils do. All of that the public aren't particularly engaged with.
Yeah, I mean, I'm looking at some data that you've helpfully supplied us with, Luke, as always, just ahead of the programme. Interesting stuff, isn't it? I'm looking at one finding from a survey that 7 out of 10 people say social care costs should be met by the government through general taxation. And maybe the clue there is met by the government through general taxation. They think it should be paid for, but maybe not absolutely by me.
Yeah, and look, in lots of these types of questions, the public will say, I'm happy for higher taxes to pay for something, and very often they might be imagining other people paying those taxes. We do know that in some of our other surveys, there is a growing preference to reduce the tax burden amongst the public. Nonetheless, I think in that same polling, I thought it was significant that 3 in 5 said that providing good quality social care should be a priority, even if that means higher taxes or spending cuts.
Yes.
And specifically, we mooted in the poll. Obviously, we don't know what the actual proposals for funding it will be, but we asked about this idea of a 10% levy on estates when people died. And interestingly, 47% of the public on that specific proposal said that they would back that. 21% opposed it. Now, those numbers will shift as proposals are debated, but as an opening gambit, it does seem that there is some willingness amongst the public to have this conversation.
Yeah, have the conversation. The conclusions left pretty wide open, and that general presumption that people, everyone wants better social care when they're asked that particular question. Who pays and whether one pays themselves. The question of estate taxes, for example. I'm doubting there's going to be a huge amount of enthusiasm for that idea when it's specifically put to the general public.
Yeah, and look, as I say, this idea of the 10% levy has plurality support at the moment. I think once people dig into what that means, some people might change their view. It's interesting, already we can see a little bit of a left-right split emerging on that question. So Labour and Liberal Democrat voters much more likely to be supportive of the idea of a levy. Conservative and Reform voters tending to be more opposed than average there as well. So, there is a bit of a difference. And of course, the moment there is a concrete proposal, opposition parties, if they haven't bought into this idea of a cross-party consensus, will start campaigning on it. Then public opinion might shift one way or the other. And so I think Andy Burnham's challenge, actually, in this year before we get to the proposals, is to bind people in to the idea of something that we all perhaps have to pay a bit more for, make those fairness arguments so that when the proposals come, they're not seen to sort of come out of nowhere. What he will be wanting to avoid, what he'll be wanting to learn from is that experience of cutting the winter fuel allowance and how that landed. Is this an opportunity to do policy slightly differently through this big conversation which has been talked about today?
And it was, I think, a particularly telling point made by Louise Casey when she invoked the memory of the post-war period, when there was that sense of national mission and people pulling together and even a willingness to endure some sacrifice, because that is the kind of spirit which, in peacetime now, is going to have to be replicated in this discussion, isn't it?
Yeah, and look, I think people are aware of challenges like an ageing population. One of the things which I thought was quite interesting in our polling this week is we asked about this idea of, well, actually, should you pay more if you can afford to pay more, even if that means you're paying more for the same service? So should the wealthy be putting in more for social care than those who are poorer? And interestingly, again, almost 3 in 5 Britons said that the amount people pay should be based on their wealth and their assets, even if it means those who are richer paying more. So there does seem to be this desire for social solidarity there, a recognition, certainly because approval and satisfaction with social care is lower than with the NHS, in some cases quite significantly lower, a recognition that something has to change. The real question, though, is when the rubber hits the road, when those proposals for how to pay comes out, do the public think, you know what, this is right, this is fair, or do they think this is asking me to pay more for something when actually it should be paid for elsewhere by someone else?
All right, Luke, good to talk to you as always. Luke Tryl there, the director of the pollster More in Common.